The Somali government, with support from the United Nations Population Fund, has launched a mobile maternity system. The system is part of efforts to scale up humanitarian response for people living in hard-to-reach areas. This includes displacement camps where the government cannot develop permanent health services.
Somalia is ranked 6th in Africa for high maternal mortality ratio. An estimated 1 in every 12 women in Somalia dies due to pregnancy-related complications, making it one of the highest fatality rates in the world. The launch of mobile maternity clinics is expected to improve access to remote areas where provision of health services is a big challenge.
This is an initiative which is aimed at providing timely and accessible maternal and newborn care into remote and hard-to-reach areas. And I want to explain this by saying that these are maternity units, they are mobile clinics that are motorized, and they are containerized, which will be moving from one point to the other in order to take healthcare and healthcare services to people. I will believe that through the deployment of these units, we'll be able to bring skilled healthcare professionals and equipment to meet those who need them.
According to UNFPA, the mobile maternity units provided are expected to serve thousands of pregnant women and newborns across 5 different locations in the country.
These 5 units will be able to take care of between 250,000 and 375,000 women across the humanitarian circumstances. And we also believe that about 10 to 15,000 pregnant women will benefit from this because to prevent death and to prevent the maternal mortality. And it's all in line with UNFPA's 3 transformative goals, which seeks 1, to end preventable maternal mortality in Somalia. That is the first one. The second one is also to end the unmet need for family planning. And the third has to do with ending gender-based violence.
There are about 3,000 verified IDP sites across Somalia with no proper health facilities. The government of Somalia says the project is a big relief to millions of its citizens displaced by conditions such as drought and conflict.
The government cannot develop permanent health centers in private lands that shelter IDPs because they can be evicted anytime. Therefore, it has become sustainable to deploy mobile clinics to take care of the needs of these people.
According to the Humanitarian Needs Overview report this year, only 39% of pregnant women who are displaced have access to antenatal care services. Somalia's health sector is recovering from years of conflict, and some areas are still very hard to reach. The support from UN agencies is very crucial for Somali government to provide essential services such as health. Mohamed Kahir, CGTN, Mogadishu, Somalia.